Well, good morning, everyone. Bonjour, hello, buenos dias, guten Tag. My name is Marion Pitters, and I'm delighted to be the facilitator for today's webinar. I'm here to introduce our expert speaker, moderate some questions from you, our audience members, and ensure that the webinars progress according to the schedule so that we respect everyone's time. But first, on behalf of McMaster University, it's my pleasure to welcome you to the third webinar of the series, The Arctic, a Global Health Perspective. We have over 100 participants registered from all over the globe, about 17 countries, graduate students, faculty from McMaster and partner institutions, as well as representatives from the World Health Organization, the WHO, and some select invitees. Many of you are preparing to contribute your skills to Arctic global health. We welcome you all to today's compelling session. This webinar series explores diverse perspectives on Arctic global health. Despite documented health disparities between the circumpolar north and other regions, the Arctic remains an underrepresented area in global health research. This series offers a transdisciplinary look at key global health challenges and opportunities in the High North. A quick overview of the 10 webinars is on our Global Health website. Today's session is Webinar 3, The Arctic, a Global Health Perspective. It features Dr. Jennifer Spence, the Executive Secretary of the Sustainable Development Working Group of the Arctic Council. Time has been built in for questions and discussion at the end of Dr. Spence's presentation. Please use the chat tool to submit questions electronically at any time during Dr. Spence's presentation. And note that while we may not be able to get to all of your questions, we will aim to address them afterwards on the Global Health website. This webinar series has been inaugurated by Dr. Andrea Baumann, Associate Vice President of Global Health and Director of the WHO Collaborating Center in Primary Care Nursing and Health Human Resources, McMaster University. Andrea, will you please start us off with a few words about launching this webinar series?
Thank you very much, Marion, and I want to thank everyone for joining us. Actually, for those of you outside of Canada, we have a very, very snowy day in southern Ontario, which is makes us climate-wise align more with our Canadian North. The Global Health series is a 10 or 11-part series, and to reflect looking at the transdisciplinary nature and the complexities of global health and the Arctic. We called together a variety of people to get different perspectives, and I'm pleased to say we've had very good attendance and interest, so I want to thank everyone for, again, joining us this morning. We have many people, as Marion said, joining us, including our students and our faculty and partners, our 7 university partnership that we have in global health, and to listen to these unique learning opportunities. And it's been our privilege to launch this series for you. And again, over to you, Marion.
Thanks, Dr. Baumann. Today we have the pleasure of hearing from Dr. Jennifer Spence. Dr. Spence has extensive experience in Arctic governance as Executive Secretary of the Sustainable Development Working Group, better known as the SDWG of the Arctic Council. The SDWG focuses on the human dimensions of the Arctic, working to protect and enhance the environment, economy, social conditions, and health of Indigenous and Arctic inhabitants. Jennifer is an Ottawa-based adjunct research professor with Carleton University's Department of Geography and Environmental Studies and is an instructor in the Northern Studies program. Jennifer has also worked with the Center for International Governance Innovation and has interests in institutional effectiveness and public policy and the opportunities and challenges facing Canada's North and the broader circumpolar region. When not working, Dr. Spence likes to train for triathlons or curl up with a good book. In addition, with these COVID days, she contends with 2 teenagers who are not happy with remote learning. Jennifer, thank you for presenting for the next 30 minutes. I'll provide a 1-minute reminder, and then we can move into a discussion with the participants' questions that come up in the chat section. Over to you now. And you'll have to unmute yourself, Jennifer.
Trying again. Can you hear me now?
Yes, we can. Thank you.
Okay, great. Thank you. Well, you missed the best parts of my presentation because I just said some brilliant things. So yes, thank you very much. I come to you, as Marion's made clear, with multiple hats. But I think that for me, COVID-19 is such an interesting example of how interconnected things are, both in terms of the work that we do and the issues that the Arctic faces. So I have to just cover some of that, but recognizing that there's a lot that can be covered, and so I'll do my best, but I welcome any questions that you have. I'm going to start, let me just move my slides along here. So I'm going to start, the organizers asked that I do a quick Arctic Council 101. And then I'm going to talk about sort of the idea that it's a global pandemic, but that the COVID-19 really is experienced locally, and especially in the Arctic context, that's important to understand. Then I'm going to touch on sort of an Arctic response to COVID-19, and then perhaps sort of in an interesting twist to end things, I'm going to talk about how this pandemic could actually be seen as an opportunity for the Arctic. So first, moving on to the Arctic Council 101. I can't do justice to this, but I hope, I know that next week, hopefully Dr. Poto will be able to touch on this and where the Arctic Council fits. I can tell you the Arctic Council is sort of understood as the regional body. It includes the 8 member states. It has permanent participants, which I'm going to talk about in a second. And the work of the Arctic Council is done through 6 working groups. And what we also see with the Arctic Council is grown in popularity and attention as attention has been placed on the Arctic. And so there's a growing number of observers, both states, intergovernmental organizations, and non-governmental organizations that also participate in Arctic Council work. So first, the 8 Arctic states. So I thought maps are usually the best way to do this. And so here you're looking at a map of the 8 Arctic states. The most sort of larger, well-known ones being Russia, the United States, Canada. We also have Greenland there, and so the Kingdom of Denmark is recognized. We have Sweden, Finland, and Norway. And then just you can see in the Arctic, and there's a ring there for the Arctic Circle. Iceland is also a member and fits just into the Arctic Circle, just it's far north, and so it is a member as well. So these are the members of the Arctic Council that make up the core of the Arctic Council. But in addition to the Arctic states, I think what makes the Arctic Council incredibly unique is since it was created in 1996, there are representatives at the table for different Indigenous organizations. And these organizations hold a special place at the table. They sit with the Arctic states at the table. They're part of all of the consensus-based decision-making that happens there. And so at all levels, right from the ministerial level right down to the expert group level. So they have a very important place to play and a strong voice. But I would also say that the Arctic Council itself gains particular legitimacy by having Indigenous organizations at the table. So this is something that makes the Arctic Council unique, but also I think makes it something that really informs the way that it works. So touching on this is sort of a basic map of how it works. You see at the top of that there, the Arctic countries, but just below that, the permanent participants. And then, as I mentioned, you have observers. But the work of the Arctic Council really happens, all of the day-to-day work happens in the 6 different working groups. Of course, the best one, as I will bias in a biased way say, is the Sustainable Development Working Group. I'm just kidding. Everybody, all of the working groups do a lot of amazing work and cover a broad area around sustainable development and environmental protection. And increasingly, you'll see that the working groups are dealing with issues in a horizontal manner. So they're really sort of actually working together to cover a lot of the things that need to be covered. You often have one working group lead something, but work in partnership with others. So we really try to find ways to advance things collectively. And I would say COVID-19 is actually a really good example of that. What we've seen is that as much as the Sustainable Development Working Group has played a leadership role in a lot of that work, the other working groups also have important roles to play when it comes to human health. And so it's important that we draw on all the expertise. There's no shortage of work to do, and so we need to find ways to work with all of the working groups and also with institutions outside of the Arctic Council that have the expertise and that we can really build something together. So moving to the question specifically of the global pandemic. So I guess what I would sort of open by saying is what we can understand in this context is that to think of the COVID-19 as a shock, it's a global shock to the system, right? And this shock is really a way that tests the resilience. And it tests resilience at multiple levels. So we've seen the implications of COVID-19 at the global level. We've seen it at national levels. We've seen it at regional levels, but we also see it all the way down to the local level. And what's important to remember here is that the context is really important when we're thinking about what that shock, the impacts of that shock, and how it is managed and how it is best responded to. And this is where I think, Marion made the point at the beginning that the Arctic is unique and is often very poorly understood. And so the impacts of a pandemic, but not just the pandemic, but also the responses to the pandemic are very poorly understood, and we need to take the time to understand the unique circumstances and the unique implications of the pandemic in an Arctic context. Keep in mind that the Arctic is made up primarily of smaller, quite remote communities. These are huge spaces, and this is across the circumpolar region. We see a larger number of Indigenous peoples in the Arctic, and they are very much, these are communities that are very much grounded in the land and in the places that they live. So it's very a place-based understanding of the way that cultures and economies and societies work is really important. We also know that there's also great infrastructure deficits in the Arctic, and that includes when it comes to health infrastructure and health services. So one of the things that really stands out to me is some of the decisions that are made about how to respond to COVID-19 can be quite challenging in an Arctic context. One of the big things that we've all heard, or we heard a lot about when we talked about the best protection from COVID-19, was to wash your hands frequently. Well, let's ask the question, how does that work in a context where you may not have access to abundant, clean water? How do you follow procedures in that context? So the type of advice that's provided is very, very difficult. How do you self-isolate in communities where there's a shortage of housing and where you have overcrowded houses? How do you respond to that if someone contracts the virus? What would you do in that context? What's the advice that's unique in that local context? How do you actually respond when there's those deficits? Interestingly, we see that it had effects on supply chains for food and really important aspects like that. And so what we know is that a lot of the decisions around the pandemic are really being taken in the south. So our national capitals in all of the Arctic countries actually are in the south of those countries. And so a lot of our policymakers don't actually necessarily appreciate or understand the context that they are trying to manage policy and implement programs that may or may not be appropriate or relevant in an Arctic context. So these are all things to think about. And just to make a pitch, I'm sure that Dr. Wei, who's going to be speaking about economic development and policy in the North, will talk about some of the unique contexts around the unique northern environment. So that would give you another example of that. So moving on. So COVID-19 is something that early on last spring, we came together by a community of people that work on Arctic issues and recognized that this is something that needed to have some attention, that we couldn't just sit and as the Arctic Council not respond, that it really was important that the Arctic Council take a leadership role. But that leadership is about bringing together the right experts. We have amazing networks of experts and knowledge holders that work with the Arctic Council. And so what we did in April of last year was we really brought together, we reached out to that network and we tried to identify sort of key issues that were going to be areas that we felt needed attention. And in the space of 5 weeks, we worked with over 50 experts and knowledge holders to bring together a document, which I'm happy to share a link to so that people can look at it, a briefing document for senior Arctic officials of the Arctic Council. And we took the first half of that document really focused on the health issues associated with COVID-19, communication of health issues, how you manage it, the infrastructure issues we talked about. We talked about mental health. And some of the broader issues. But we also, the second part, actually looked at the broader implications. So we looked at the economic implications and the social implications. We looked specifically at what it meant for vulnerable populations in this context. And we really tried to take a broad lens to what health impacts can be in the Arctic context, really draw out the unique impacts in an Arctic context to try and help us focus moving forward. But this was really something we couldn't do alone. We really drew on and had amazing support from a large quantity of people. So just it was more about the convening function that the Arctic Council was able to play in this space, and I think it was a huge success. But it's only the beginning. I mean, we know now, I think all of us, that COVID-19 is going to have longer term implications, and so we now need to continue that work. And in terms of speaking about the how of the response, you've got some great speakers coming up in this session as well, including Dr. Lubacek, who's a former colleague of mine. She used to be at Carleton University, who I know will really speak about how important it is to directly engage communities in these discussions and ensure that the responses that we have and the policy advice that we provide is really driven by the communities. So what did we find in that research that we did? Well, we found these are the core themes of what we found is that there is a value. I mean, a lot of the work is happening locally. A lot of the work is happening domestically within different countries, but there is a value to international collaboration. There are lessons learned. There is information to be shared. There's data to be shared. And we really know that expertise and that knowledge, there are common elements in the Arctic context, and we really need to think about how we work together. There's, again, to find the gaps, connect the dots at an international level. And so looking at ways to do that and continue to strengthen those networks of experts and knowledge holders is absolutely critical when responding to a shock like COVID-19. We also know that Arctic peoples, they need to be leading the efforts. We've heard again and again, and COVID-19 just becomes an extremely prominent example. We know that they know their issues, they know their environment, and so we can be there as experts to support that, but Arctic peoples need to be leading the effort to respond, and we need to find ways to hear, listen, create the spaces to hear those experiences and understand that context, but to move that forward, but really led by Arctic peoples. Again, some of the examples I provided, we really came back to the impact of fragile and absent infrastructure. You can't, these are long-standing deficits, and long-standing deficits that people that live in Arctic communities have been talking about for an extremely long period of time. But the COVID-19 actually became a means for people to really show the vulnerabilities and the implications of those vulnerabilities for the people of the Arctic. When you have when you're a remote community that is only accessible by air, and the only airline goes out of business, those are fundamental parts of the infrastructure that cannot be ignored. When you have fly-in, fly-out communities and somebody contracts COVID-19 and that goes into a community where there's no health facilities, the risks are so much higher in that context that we really need to understand that. The other part of it is that we really had to acknowledge the unique health and social needs of the Arctic. We know, for example, that mental health and suicide are huge issues, especially among youth in Arctic communities. And so what we know is that a shock like COVID-19 are situations where there may be additional resources that can come into the system, but there are also increased risks. And so we need to understand those. We know that there's higher levels of poverty in the north. So how do we respond to those, and how do we manage COVID-19 in an environment where we know that there are these challenges? And lastly, we know that there's issues with data consistency, access to data, and that taking the time to share information and coordinate research is going to be absolutely critical now when we're right in the space of the pandemic and trying to protect communities, but moving forward as well as we look at the recovery from a pandemic. What might that look like? So I'm just moving on. But I think the other thing is and I really want to leave this sort of on a future-looking component, is that the Arctic Council has committed to continuing its work. The Sustainable Development Working Group has been asked to lead this, but again, I can only reiterate, we really see this as a convening fund that will bring together experts, that will bring together knowledge holders, and there's almost a proliferation of work that's being done with COVID-19, and we need to recognize that in our enthusiasm, we might all run off and do a whole bunch of research and be working and with the best of intentions, but really taking the time to map out and prioritize based on the needs and interests of Arctic communities, and then drawing together the relevant experts, the relevant stakeholders, the relevant people to really understand where we should be prioritizing our efforts, but also who's doing what, who has the expertise to do what. Really connecting those dots is going to be critical. The other opportunity that we see is because the pandemic has really demonstrated those existing vulnerabilities, we have an opportunity to really demonstrate those impacts and perhaps push an agenda of responding to those vulnerabilities in a meaningful way without being opportunistic, we know that with the pandemic, there's going to be huge efforts to build a recovery. And so there is going to be money being put towards that recovery. How can those funds, how can that effort, how can that energy and attention be mobilized to respond to long-standing vulnerabilities so that we don't just sort of attempt to return to the status quo, but actually build towards something that is even stronger. And so with that, it actually leaves us in an interesting place. One of the things that's been also really interesting is that the pandemic has really demonstrated some of the amazing strengths of Arctic communities. Their resilience in the face of pandemics, their resilience in their innovation as communities to come together and respond, to protect elders, to get out in the land and share food, to really respond to COVID-19 in ways that are unique and relevant to the needs of these communities cannot be understated. And so I would actually challenge us to actually learn from the North when it comes to dealing with a pandemic like COVID-19. What can we in the South learn from the North and recognize and acknowledge that strength and what we as a global community can learn from this? And I would say there's actually a lot. There's an incredible amount of cultural and social and economic resilience and vitality there that we as a globe can really learn from. And I think this is an opportunity, and this comes to a personal perspective, that the Arctic Council has never really had to respond quickly to a challenge like COVID-19. And I think that what we've seen with the Arctic Council and its response to the pandemic demonstrates that it can have that flexibility and that it can play a meaningful role again as the convener and the intermediary between policymakers and experts and knowledge holders to really advance and respond to COVID-19, but then hopefully to other policy challenges and issues as well. And so I hope what I would like to see is that we actually don't see COVID-19 as a situation where we return to the status quo, but we think with innovation and creativity about what a future looks like for the Arctic, one that goes beyond and, as we say in resilience speak, bounces forward. What does a vision for the Arctic look like, and how can we get there given this shock, and not just assume, which perhaps we do a lot in a southern context, just assume that we're all waiting to return back to something else. And so I hope that we can be there to support Arctic communities and to make sure that they are the ones defining what that change looks like and setting the priorities for course forward. And I hope that the Arctic Council can be there to support the communities as they do that. And I'll stop there.
Thank you so much for that compelling presentation, Jennifer. You really provided an overview of what the working group is up to and how they've been working together under these, I guess we could say, unusual times. So thank you so much for that. The first question that comes up is, the Arctic is a large region, as we know. Just looking at that map, it just is a really critical reminder of just what we're talking about. We think Canada is geographically challenged in the south, but nothing like what you're talking about in terms of the Arctic region, the high Arctic. So having said that it is a large region, how would you say Canada has done so far in responding to COVID-19 in its north?
Yeah, It's a great question. I mean, what's been fascinating for me to watch is the leadership role, in particular, that communities have taken, and some hard decisions, frankly. Territorial governments have taken some fairly drastic, to varying degrees, approaches. So Nunavut, for example, has really taken a role of recognizing the risks of COVID-19 being brought into those communities, has really closed off borders. And I think that the numbers of the infection rate in the Canadian North is really a testament to the work that those governments have done. It doesn't come without its challenges in terms of community members being able to move, and I know that there are also issues of, we create boundaries, and they're not necessarily boundaries that all community members sort of recognize. So a lot of the time between the Yukon and Alaska, for example, that can cause problems when people are actually interested in visiting family or that sort of thing. One of the really fascinating things to me is some of the community-based initiatives that have come up, and things like on-the-land programs. So one of the ways that a lot of communities have responded is to actually leave and go out on the land, and there's been funding support for that. So I think, again, Canada is an example of where there's been that innovation, and where communities have really sort of tried to draw on the resilience that they have, community support that there is, to really to protect what's important to them.
And having looked at Canada, I'm wondering if you could tell us of any stories of other countries that you think have just done amazing work in the high north with respect to COVID-19. Are there examples that other countries that come to mind, Jennifer? And while you're answering that, I'd encourage everyone to get their questions into the chat section so we can make sure that we respond to your questions. So thank you.
Yeah, well, I mean, this is the great part about working at the circumpolar level, is the opportunity for communities to share best practices. I think one of the things that has really struck me is the role of youth. And so the Sami, for example, have actually ran in partnership with Harvard University youth leadership seminar that included a simulation of 4 youth, Indigenous youth leaders, to come together. They came remotely. They were able to talk about how they would manage. I mean, it's a simulation, but a simulation to look at responding to COVID-19, which is obviously something that they could sort of identify with directly. There's also been some amazing initiatives to bring together artists, again at the circumpolar level, to share their work, to share their experience, to keep those social connections going, irrespective of the boundaries that are created by are actually not being able to move to other places. So I mean, there's no shortage, but I think that more than anything, what I would love to see is in the work that we do moving forward is to capture those experiences and those best practices and share them so that communities have an opportunity to share them. So.
Thank you so much for that. Another question that comes in delves a little further into what you're talking about, and I think people are really enjoying your real-life examples that you're providing here, Jennifer. What types of new initiatives have been taken, excuse me, to promote the mental health of youth? You mentioned earlier in your presentation that that was something that was really high profile in Arctic communities. And just in the face of the pandemic in particular, are there initiatives that are being taken up that you would say those are real exemplars in terms of promoting mental health among the youth?
Yeah, it's an incredibly important issue. Mental health has been and I will continue to be something that we need to focus on. So I guess I would say two things. We have an expert group with the Sustainable Development Working Group. It's the Human Health Expert Group, and the chair of that expert group is from Iceland. We are right now the chair of the Arctic Council is Icelandic, and so our chairs are from Iceland as well. And she takes a particular interest in issues of mental health, and so we've seen a lot of sort of effort to talk about and to bring into the conversations we're having at the circumpolar level to really not forget the mental health issues, and to learn from other shocks like the economic collapse in 2008 and the impact that's had on mental health issues, to really keep front of mind for policymakers and experts that this is a critical issue and one that can often be hidden and one that will continue over a long period of time. But I really think when it comes to mental health, there's the most amazing work is done at the community level. The Arctic Council has, through the Sustainable Development Working Group, currently has a project called Local to Global. And Local to Global is a carry-on project specifically focusing on mental health and suicide prevention. And it brings together youth to talk about, and they do video work around that. But they've had these amazing workshops in communities that give youth an opportunity to talk about some of these extremely difficult issues, and that's really where, and empower them to have the conversations and to support each other. The next phase, or this phase that we're in now, which was planned before COVID-19 hit, was meant to try and do more work to connect the people working on the front lines and working at the local level at the international level so they could share best practices. Well, that was supposed to happen in person. We were supposed to be bringing these groups together. So what we've ended up doing is transitioning to supporting these frontline workers and community initiatives to come together virtually in a webinar kind of setup like this. But it is our aspiration that as much as we all have sort of, we appreciate the value of the online setting has allowed people to come together, that when you're dealing with issues like mental health and suicide prevention, it is still our hope that when it's safe, that we can bring people back together in community settings to share that experience and their advice with each other.
Thank you for your comprehensive response on that one. I'm going to ask you now to leap from youth over to elders. Are you with us? Okay. You mentioned that in the north or in the south, we can learn a lot from the response among communities in the north, particularly around protecting their elders. Given our poor response to protecting seniors, particularly long-term care homes in Ontario and Canada, what lessons can we learn from the north?
Yeah, it's an interesting time to ask that. A colleague of mine who I've been working with this on, who's from Alaska, sent me an article this morning with the vaccination programs that are now being rolled out. And we do know, and we've seen it in Canada as well, that there's a priority being placed on remote northern communities and Indigenous communities in vaccination programs, which I was extremely happy to see. But what's fascinating to me in the article that was shared is the communities are playing a role in the north in identifying, because there aren't that many yet, right? The vaccinations, the access to vaccines is limited, and it's elders, knowledge holders of languages, elders who are seen as carrying critical pieces of knowledge for the community, that they're choosing, communities are choosing to vaccinate these elders first, to prioritize elders ensure that they are safe, and that is something that is critical. We also see it in the way that elders are being supported in terms of food sharing, in terms of cultural support and making sure that that they are taken care of. And this is something that, frankly, we don't have in a Southern context in the culture, the way that we often work, especially in larger cities. So it's incredibly empowering to know, to talk about how communities are really stepping up and supporting elders.
So one more question on that, if we could just delve a little bit into that and the politics behind it. So if we set up a situation where the South is open to hearing about how successful those approaches have been in the North, what would it look like? How could we get politicians in the South to look to the North and say, gee, you folks are doing a really great job of that up there. We'd like to take some of your ideas. How can we encourage that type of influence instead of always looking to the South for solutions up North? Can you talk a little bit about that, what that might look like?
Well, I mean, for here, it's the most obvious. I'm switching topics here is to talk about climate change. Climate change is happening in a way that we can't, in the South, we don't even understand how it's happening much more rapidly in an Arctic context. And that means that there has been and there will continue to be rapid adaptation. We can talk about mitigation, but frankly, at the speed with which climate change is happening, these are communities that are having to adapt. They're having to be resilient, and these are also communities that deal with extreme conditions of weather. So their resilience in this face of change is you know, as communities, is far superior to ours. So I mean, not to change. I know we're talking about COVID, but I think understanding that that ability to adapt and be resilient and be flexible, we frankly don't do that very well in a Southern context, and also a mentality of future generations. We don't do very well in making decisions based on future generations, and so I think it's almost a question of how you make decisions, and it's a learning from the resilience and approach to decision making we need to bring from the North, and to teach the Southern policymakers is really about a different approach to the way we understand issues and how we bring together knowledge and make decisions.
Thank you for that. I know you mentioned the economic collapse in 2008 and how the North came through that. Could you just remind our webinar participants very briefly what the 2008 economic collapse was about for the North?
Yeah, well, the fundamental, and it's been over a period of time. So I mean, there's been multiple collapses, in the economic collapse in 2008, but then through to sort of the 2012, 2013, 14 period. And so for larger centers, you saw an economic collapse because the financial institutions globally were in trouble. But another aspect of that in the North that's unique to the North is oil and gas and the decline in the value of resources, non-renewable resources. And frankly, the North remains heavily dependent on a lot of oil, gas, and non-renewable resources, mining, and those they're not. The economies have not been terribly flexible from that perspective, and so when you have economies that are so dependent on a resource like that, and then there's a decline, it has huge implications for communities that are dependent on that. Although, then you get me off on a tangent again, we also know that a lot of the value of those economies has not stayed in the North. And so when we talk about economies, and when I talk about moving forward, instead of trying to go back to something, it's about finding a diversified economies and supporting diverse economies. And so when we look forward out of COVID and the challenges that has caused, how can we look forward into enabling healthy, vibrant communities that are based on, more sustainable options, ones that are appropriate to the communities in which they exist. And I think there's a lot of amazing options there that we wouldn't necessarily look to if we hadn't seen the challenges we have right now.
Okay, thank you for that. And we'll bring you right back to COVID now. No more tangents. Can you speak a bit more about how you connect across scales and across countries to be able to respond to unique and shared community priorities at the global scale of the Arctic Council?
Yeah, well, I mean, ultimately, it's recognizing that in the Arctic context, that many of the experiences are shared. And so when we think about, I mean, there are differences, but the idea of smaller remote communities is shared across the Arctic. The idea of sort of extreme weather conditions is shared across the Arctic, although it does vary. And the sort of the remoteness from their southern sort of parts, those are shared experiences. And so when we think about a global situation, we have a tendency to work within our usual ways of thinking about things. So whether it's at a national level or a regional level, but we're not very good at thinking across different jurisdictions in a way that we can learn. And one of the things that, for example, data on vaccinations and delivery of vaccinations in very similar contexts, we're not collecting and this isn't the only place, but we're not collecting the same types of data in different jurisdictions. So having the conversations with the officials that are collecting that data to make sure that we collect the same types of data so that we can compare that information becomes incredibly important, so that we can learn more from the experiences. The experts are ready to do that, but they need policymakers to be ready to allow them to do that. There's quite an amazing network of health officials in the Arctic that recognize the need to do that kind of work. Sometimes the barriers are through our domestic officials.
And certainly students and researchers in global health at McMaster and its partners would know about those challenges that you're raising, Jennifer, for sure. It'd be very real for them. Another question about research, if we could just tag on there. The pandemic has clearly had and will continue to have a significant impact on the Arctic. Where does research need to focus moving forward? You mentioned about having similar formats for collecting data. Are there other areas that research needs to focus moving forward?
Yeah, for me, I mean, this is my personal opinion. One of the things that strikes me, and we've been doing this work, is there's a lot of amazing research that's going on. I mean, the reality is that something like a pandemic mobilizes great minds who want to understand, who want to be able to provide analysis, they want to provide advice. So to me, there's no shortage of work being done. The challenge is that not everybody's talking to one another. And so we don't know what work is being done at the circumpolar level. We have an initiative. I'll give you a perfect example. The Sustainable Development Working Group is in the process of putting together a new project on health outcomes, in the Arctic, the different Arctic states. And it's a multi-phase approach, but there's going to be community research in each of the 8 Arctic states. So one of the things we do is we send out that project proposal to our networks and say, what do you think? Is this a good idea? Is this a good approach? And the feedback is, well, hang on, we're doing a part of that here and in this country, and what about that country? Are they doing something? And so you get people with the best of intentions who are doing overlapping work, when really what we need is to think about, okay, so you're doing that, that's great, that's covered, and then where are the gaps? And how do we prioritize the research that needs to be done? And so what we're trying to do right now is have a concerted effort to map the research that's taking place in the circumpolar region related to COVID-19. And if we can map it and share that information, so make it publicly available so that, you know, if somebody's doing research on health outcomes in Alaska, they can find out that there's somebody in the north of Norway who's doing similar research, and they can actually start to communicate with each other and share experiences and share methodologies and see if they have similar data, and then you amplify the value of those types of research initiatives. So my fear is not that we're missing the research. My fear is that we might have too much, you know, we don't know what's happening and we don't know where the gaps are.
So Jennifer, how would you advise students and researchers that are listening to you today, if they want to do research or have already embarked upon research around global health in the Arctic, what would be the best way for them to move forward, understanding that they don't want to be duplicating or cross-referencing overly? They want to do something that's unique and helpful. What would be your advice to them? How would they proceed?
Yeah, so it's a great question. I mean, we are looking at for COVID in particular, we are looking at creating a platform that will allow people to share that information. When it comes to human health more broadly, there is a network of Arctic human health professionals, and so, you know, trying to find those networks and tap into those networks that exist. I think I always think that then, I mean, you're working with a community, and those networks are much more likely to be tapped into the communities that are working with those networks as well, because that's such an important part of it is to make sure that you're also doing work that's relevant to the communities in the north.
Okay. This will take us back to the actual infrastructure of the Arctic Council. You mentioned the rising interest in joining the Arctic Council. What do you think is driving this interest?
Well, I think it's a new the way it's often put is, you know, it's a new frontier in two ways. Is climate change makes the Arctic more interesting, both because it's the canary in the coal mine for climate change. It's the impacts are drastic in a world where people seem to struggle with recognizing that climate change has an impact. So you have that sort of environmental lens, and then you have another stream of interest, which is it's an opening frontier for new economies and new transportation routes, and it accesses a new frontier to a place that before was seen as inaccessible and at the peripheries of the global economy, which now has a different role. So there are different reasons people are coming to the Arctic, and there's conflict between those different reasons people are coming and have an interest in the Arctic.
Okay. This question now leaps us over into vaccine hesitancy. So I hope you're ready for a change of topic once again. Is there a way or a need for the Arctic Council to support the vaccine rollout in the Arctic? So that's part one of the question. And part two, is there the same degree of vaccine hesitancy in the high north that we see in the south, or do you have any sense of that at all?
Yeah, I mean, my understanding. So first of all, the role of the Arctic Council, the vaccine rollout really, I mean, because of the differences in the jurisdictions where there's vaccine, I mean, even Canada, we have multiple plans because of the role of provinces and territories. But if you look at each country has its own way of managing. So I'm not sure that the Arctic Council is best positioned to play a role in vaccine rollout, just simply because it would add a layer that I don't know would add value. Where I think it would be useful is, I mean, part of this is to understand how pandemics work and how we manage them so that we can learn for the future. And I think that there's a place for the Arctic Council to be able to inform future action around a future pandemic or a second other wave, or all those types of things that we need to think about what the role of the Arctic Council is there. But I wouldn't argue that they could in some way manage vaccine rollout. It's in terms of vaccine hesitancy, any information I have is simply anecdotal, but my understanding from speaking to colleagues who are working in health is that there is absolutely same issues, and that there's a huge amount of effort being put in by experts to communicate, to share, to provide information in the same way that we see it in other areas, but really to try and respond to that hesitancy with information, with facts through our public health officials. But it is a battle of who has access, and issues of poor information being sent through social media is as prevalent in the Arctic as it is in the South. And there is once you've instilled some sort of concern, smaller communities, it's almost what I've heard, again, this is anecdotal, is where you have uptake, then there's uptake because the community sort of reacts as a community, and where there's resistance, the resistance can be quite strong as well, because the communities are so tightly knit.
Okay. You mentioned earlier about the membership of the Arctic Council, the diversity in terms of people from the high north and so on, people from around the globe. Can you talk a little bit about, we mentioned age a number of times in this webinar, can you talk a little bit about the representation from both elders and from youth on the Arctic Council and what that looks like and how it's protected?
Yeah, it's an interesting, more on the youth side, although there's been a few conversations lately, but there's been a real movement over the last 2 years, and Iceland is the current chair of the Arctic Council, and it's moving into Russia in May, and they've already indicated that they will maintain a priority on youth engagement. And so what we're seeing is a huge effort to try to create better opportunities to engage youth in Arctic Council work. And this is happening at the working group level, and it's also happening at the senior Arctic official level, so the sort of senior diplomat level. So they've just announced an internship with the Arctic Council Secretariat to have a young person actually develop a youth strategy and having a youth advisory committee to senior Arctic officials. We also have in the Sustainable Development Working Group, we're just about to launch a fellowship with two of the Social Science Association and the Science Association of the Arctic, and they will be having a fellowship available through that. And then one of the other working groups, the Biodiversity working group, is actually they've put together a youth strategy. They have an internship program already, so there's a real recognition that we need to do a better job at engaging youth, but some real effort. And the Indigenous Peoples Secretariat, in fact, the permanent participants have actually created a committee of youth, and they each have a youth delegate on it as well. When it comes to elders, one of the pieces of feedback I've heard a number of times is, wouldn't it be great to have a youth elder sort of membership group to guide. It hasn't sort of got any legs yet, but I think we'll see sort of the need and the recognition for the more engagement by elders as well.
Thanks, Jennifer. We're coming to the end of things, so I just want to thank you and start to wrap up. First, people are asking if you could put the link to your report in the chat section before the webinar concludes or afterwards, whatever works for you there. I want to thank all of the participants for those compelling questions. We've got quite a range today, and I think that speaks also to your excellent presentation, Jennifer, that you were able to incite such brilliant questions. So I hope the webinar is useful to everyone and relevant in expanding your perspective of global health in the Arctic. Thank you all for attending, and special thanks to you, Jennifer, for an excellent presentation and the insights that you took on in the Q&A. We look forward to hosting the fourth webinar entitled Arctic Governance, which, Jennifer, you referred to. That's on Monday, March the 1st from 10 to 11 Eastern Standard Time. And that features Dr. Margarita Paula-Poto, Associate Professor at the Arctic University of Norway and researcher there in the Faculty of Law. We look forward to seeing everyone at that next webinar on March the 1st. Enjoy the rest of your day, everyone. We look forward to your participation in March. Thank you and merci.